This whole effort of the Todu Guam Foundation is really to be able to take the bull by the horn, as I say, and be able to address the problem that we have for so long, which is healthcare, access to healthcare. And the problem is not just our public hospital. The problem is our people don't have that ability, don't have the hand up to help them be able to provide something good for their family, a right that every man, woman, and child has, and that's access to quality health care.
All these years, DOE always have many challenges, especially with healthcare needs. Our students are required to have, especially kinder, 6th grade and 9th grade, they're supposed to have health requirements, which include immunization, TB skin tests, and physicals. The biggest challenge is majority of our population is either MIP or Medicaid or uninsured. They have challenges with finding an appointment, or social issues, costs, no transport. These are the biggest challenges for us, keeping our children in school if they did not meet their health requirements.
The people that we saw, like for instance, we've seen children that needed sports physicals, and they wanted to join sports, but they couldn't because they don't have the money to go to private clinics. And so it gives them an opportunity to join sports and to have a well-balanced curriculum in addition to academics.
There's a lot of people in our community, and I've seen it firsthand now over the past 6 months, who don't have that ability to go to a clinic and have their kids checked. You know, a lot of them have to resort to maybe home remedies or praying real hard that nothing else happens, you know, nothing worse happens.
The mobile clinic came out, boom, we were happy, we were delighted. It was like a gift. You know, if I pick up the phone and say, Mom, your son or daughter need a TB skin test, Senator Dennis Rodriguez will be XYZ. For instance, in Istanbul, we had a huge population of middle schoolers and elementary that need immunization. So where's it going to be? I said, at Istanbul, yes, we can walk. Oh, that was great. It is accessible for them, walking distance. So it eliminates that. I don't have a ride, I don't have money for gas, etc. So this was really a great gift for us.
Our government, you know, can't be, you know, everything, can't be, you know, the answer to everything. And so as we've seen in different aspects in our community, we partner with the private sector, we partner with nonprofit organizations to kind of close the loophole, close the gaps on what our government does not provide. You know, for me, you know, just because our government doesn't have the resources or the wherewithal to get things done, our people shouldn't suffer. Our people shouldn't be put in jeopardy. So that's why it's important for us to be able to sustain this operation.
It's the accessibility, and one thing that I love, even when the students and the parents came a little bit late, the clinic advertised 10 to 1. It's 2 o'clock, it's 2:30, and I see those faces. We're not gonna say, you late. We said, come on, Mom, let's go. Let's do what we got to do. And the people volunteering, especially our physicians and nurses, no one is gonna say it's time to go. We wanna help the last person who came. And that was the greatness of a private clinic, of course. They close the door, it's time to close. Senator Rodriguez Clinic is different. It's open. You come. We're not gonna screen you for X, Y, and Z unless it's a federal mandate for the immunization. Come all, whoever needs it, we're here to help and support.
One of the things that we as physicians, that we didn't go to medicine just to make money and stuff like that. I think most doctors, our hearts are into helping people get better and to prevent more illness and stuff like that. And so it's this mobile clinic provides us that opportunity to do what our hearts dictate to us.
Without our doctors, our volunteer doctors, the nurses, the community advocates who come out to our outreach efforts, we really wouldn't be able to serve the over 1,000 residents that we have. It's about you know, paying it forward, number one. And when I look at my kids, sometimes they question me too, you know, I say, why do you do these things? You know, there was one time a lady, a family was stuck on the road. it was two ladies and the kids. Their car was stuck, and so I got down to help them push it off the road. And my son came back and said, "Why'd you do that? You know, there's a lot of cars waiting, and now people are honking." And I said, "One day, you know, when you're driving and you're on the side of the road, your car broke down, and there's nobody around, I want one person that drives by to stop and help you. Either is to jumper your car or to push your car, you know, off to the side of the road." And that's how, you know, that's how I look at this. We're not going to be here forever for our kids, and so in the future, I want to be able to know that because of what the work that I've done, the work that my wife has done, that my kids are in good hands, because we build a community that cares and loves each other, and really has the passion to just help one another. So that's really something that I you know, when looking at this effort, is what I want to be able to do.